Hi, this is part 3 now of this 3-part video series. I know we've had a very brief tour through mold, mast cells, and trauma, but now I'm going to be talking about more effective treatments than SSRIs or psych cocktails for depression, anxiety, and sleep. And the goal of the next 3 slides is to provide practical tools to prevent symptoms of depression, anxiety, insomnia, while working on removing root causes. Improving the distressing syndromes of depression with low motivation and impaired cognition is very important for successful treatment of SIRS. And a useful basic approach is to offer fish oil and start a low-carb, whole food diet. It can be amazing again and again to watch how well that simple combination, along with removal from a moldy environment, works in relieving depression and anxiety. The role of exercise in anxiety and depression is well researched as being as or even more effective than an antidepressant. Micronutrient replenishment is very important. Lithium orotate is well tolerated, useful, and increases gray matter, as well as helps moodiness. Curcumin with NAC, along with a mitochondrial supplement, and there are many, can be a winning combo for decreasing pain and improving energy. SIRS does cause dysregulation of both the immune and hormonal systems, and repairing the hormone system is vital. So bioidentical hormone replacement, along with the nootropic hormones pregnenolone and DHEA, is often necessary for restoring mood in peri- and postmenopausal women. Low-dose naltrexone helps calm activated microglia and can be extremely helpful for depression, anxiety, and insomnia, as well as mast cells. I will discuss this separately. Anxiety is extremely common in mold and just in general these days, as the CDC reports show. I recommend inositol very frequently for anxiety, OCD, and PCOS. The usual dosage is 1 scoop or 500 milligrams 2 to 4 times per day. It's really easy to mix in shakes, which is why I like it for children and teens as well as the elderly. The most common side effect is diarrhea, so it's potentially useful in patients with constipation. Progesterone for about 85% of perimenopausal and postmenopausal women. This is a total winner for sleep and anxiety. The other 15% will let you know very fast it's not. Magnesium, I always get the red blood cell levels of magnesium and keep working with the supplements to achieve at least 5.7 blood level if possible. Glycinate has the least effect on bowels. Threonine is excellent for many because it's absorbed into the brain. Passion flower and theanine work well for some. Now, choline is the precursor for acetylcholine, or the brakes in the parasympathetic nervous system. CDP choline is excellent for ADD, very useful for students. CBD is excellent for neuroinflammation, and I find it's a much better alternative than benzodiazepines for anxiety and sleep because it does not have dependence issues. Phosphatidylserine can help lower cortisol. Niacinamide decreases glutamate and overmethylation. And gelsemium is a homeopathic which can work really well for social anxiety and should be tried. A young female I treated entered 9th grade a couple of years ago and promptly fainted in class on the first day. After we found there were no neurological issues, I started gelsemium 30C 3 times a day. At her next visit, she reported the anxiety was much improved, and she'd found several new friends all using gelsemium for the anxiety. They had the Gelsemium Breakfast Club. She's now in 11th grade. She's not on SSRIs, unlike many of her female peers, and is planning a naturopathic career. I've already discussed many of the treatments I recommend for sleep, including progesterone, magnesium, CBD, and low-dose naltrexone. Melatonin has many benefits for the brain, is useful for sleep for many, and dosing can range from 0.3 milligrams to 30 or more. Chinese skullcap is one of my favorite herbs for COVID and other viruses, as well as endothelial support. Sometimes people forget that skullcap can help sleep also, and I use several botanical combinations with kava, valerian, hops, and more, and tryptophan can be useful for some. For the very sensitive, lavender oil may help, or apigenin made from chamomile also can be very helpful. And don't forget again the necessity of an exercise for treating depression, anxiety, and improving sleep. Even small amounts of movement can be helpful. In some people, that may mean just going to the mailbox every day to pick up their mail. For others, it may be mountain biking as they get better. Treating high homocysteine, which is a functional measure of methylation, can really help low energy cognitive issues in depression. It's easy to measure and treat. I consider above 7 to be high. And it's easiest to use a combination product along with increasing choline uptake. And don't forget, egg yolks are an excellent source of choline. Now, I've often stated that the border between mast cell symptoms and neuropsychiatric symptoms is porous. And in general, anxiety with underlying sympathetic overdrive is the most common psychiatric presentation I see. So if I've made a mast cell diagnosis, I continue to treat aggressively with mast cell protocols and wait until I see the effects of treatment before even considering an axis 1 or 2 diagnosis. So putting this together, I usually start treatment with H1 or H2 blockers such as Zyzal and Pepcid at bedtime. If that's not effective for brain symptoms, I start ketotifen about 0.5 to 2 milligrams TID. And cromolyn can be offered, especially if there's a lot of food reactivity. Low-dose naltrexone is a glial cell modulator, mast cell stabilizer, and extremely helpful for the neuroinflammation, or sea blue, I so frequently see in neuroquants. And this is probably the most common prescription med in my practice. Usual dosages range from 1 to 4.5 milligrams. I usually start at 1.5 and increase slowly to 4.5, which for probably 80–85% of people is the sweet spot. Sensitive patients can start at 0.25 milligrams and increase to 0.75 milligrams with benefits. I've observed that those patients that seem to have the most neurological symptoms from low-dose naltrexone tend to be the people we've also diagnosed a tick-borne infection in. I hypothesize this is because the microglial cells, when they're activated, are essentially the brain's immune system. They're being activated by the low-dose naltrexone to fight against infection, and the patient is experiencing it as a Herx reaction. When you start very slow, you can usually find a rate at which the patient can tolerate die-off, essentially. And in patients who've been on naltrexone for a long time and have symptom flares such as post-COVID or rheumatological flares, they may respond to higher dosing from 8 to 10 milligrams. It is a mast cell stabilizer, and I feel it should be tried in most mast cell patients. And when you combine it with lipoic acid, 300 milligrams twice a day, can really help neuropathy. Other useful supplements for neuroinflammation are PEA, CBD, and phosphatidylcholine. Some additional mast cell supplements are listed here for reference. In particular, Boswellia, Borrelia frutescens, and luteolin all seem to have major antihistaminergic benefits while producing very little reactivity in most. Oxytocin, the love hormone. It has many promising benefits in treating anxiety and depression. The physiological targets of oxytocin are the brain and autonomic nervous system, improving cognition and resilience, the cardiovascular system, and the bones. Oxytocin improves metabolism in multiple ways as it's protective against breast and ovarian cancer. That's a lot of benefits. Most likely, the effects of oxytocin are through modulation of the autonomic nervous system, leading to improved cardiovascular and inflammatory response, as well as increased vascularization and cerebral blood flow. Oxytocin's ability to modulate the autonomic nervous system makes it a key player in helping patients with chronic complex illness with trauma recover more easily. And this is a really nice reference chart for comparing antidiuretic hormone and oxytocin. Remember, both are necessary for physiological embodiment. Since antidiuretic hormone is both an oxytocin agonist and partial antagonist, the categories are not black and white. In many areas, oxytocin and antidiuretic hormone are similar. In two very important respects, they do differ. Antidiuretic hormone increases sympathetic arousal and can increase the stress response. This is not what we want for regulating mast cells. Oxytocin can also decrease aggression, while antidiuretic hormone facilitates territorial behavior. Not usually what we want, again, especially in today's world. And this is how I'm using oxytocin. I use an oral as a sublingual troche or controlled release tablet. The compliance drops dramatically with intranasal that needs to be refrigerated or sub-Q dosing. And in my experience, it's not more efficacious over time. 60 IUs is a good starting dosage for most. It's enough usually to decrease urinary frequency in mold patients. Higher dosing seems better for modulating the trauma response. And usually in postmenopausal patients with known PTSD, I've found dosing up to 100 twice a day to increase resiliency and improve their POTS with no noted side effects. The most important side effect to remember with oxytocin is that in settings with a patient feels are not safe, oxytocin can function as an antidiuretic agonist and increase anxiety. If that happens, stop the med, discuss the current environment, why it feels unsafe, and restarting it when the environment has been modified in some ways is usually quite successful. So I've spent a lot of time talking about problems with psych meds, and these are very real. However, mirtazapine is very antihistaminergic, can be useful in mast cell patients, especially those with severe loss, weight loss, insomnia, or pain. And nortriptyline, oldie but goodie, is a triple histamine blocker and very useful for pain, especially headaches. And the one SSRI I do use is fluvoxamine. It can be very successful OCD, which is crippling. Again, risks and benefits. It has multiple benefits, including mast cell stabilization, and has made a meaningful difference in the lives of some of my patients with OCD. And here are some of my favorite treatments for every symptom mentioned today. Restoring vagal tone and balancing the autonomic nervous system can be helped by multiple body modalities, including lymphatic drainage, cranial sacral, qigong, tai chi, somatic experiencing, network chiropractic, functional neurology, visual therapy. Of all of these modalities, they tend to improve vagal tone, and their biggest advantage is there's nothing to react to. I do always point out for people who are highly inflamed, massage techniques like Rolfing tend to release way too many cytokines and make the person feel much worse. I could spend an hour just discussing these modalities, but I think it's time to end the series. And here are the references I promised, and some more references here. And I hope this brief introduction has stirred your interest in reevaluating how safe and effective SSRIs really are, has given you some fruitful areas to look for addressing the root causes of psychiatric illness, and has given you some more ideas for safe and effective treatments for the onslaught of patients with mental health symptoms that we're all seeing in our clinical practices. Thank you for listening.